So I'm Claire Harris. I run a mental health training and consultancy business. Really great to hear what you were talking about volunteering. So I did some volunteering at the weekend. I'm part of a running club, but my husband currently has a broken ankle. So we were marshalling at the weekend. And it was actually so nice to cheer people on. It's a really good thing for mental health, which really links very much into what I'm doing. So as I said, running a training and consultancy business called Promote Mental Health. We offer mental health first aid, which is training where we can go into an organisation, upskill those people in terms of recognising signs and symptoms around mental health, supporting and signposting on services. So similar to physical first aid, mental health first aid is quite a new area, but organisations may soon have a right where they have to have a certain number of mental health first aiders like physical first aid. There was a bill going through Parliament that is obviously on hold at the moment with the election, but we're hoping that's going to happen as well. The WHO, which Renata's asked me to talk about, I work with managers, with HR teams, with organisations, CEOs as well, to work out where the organisation is on their workplace journey, where they need training, for example. So a lot of people ask for their managers to be upskilled, they're supporting teams, and they don't know how to have those conversations. So we go in, work out what the needs are for that organisation and design bespoke training. So we can offer mental health first aid, we can offer training around resilience, stress management, suicide prevention, big issue for businesses, particularly for supporting men around mental ill health, change in organisations as well. But the managers is kind of the key at the moment, where people are saying, our managers aren't skilled. They need to have these conversations. Can you support us? So we work in lots of different sectors, the prison service, with police, initial recruits and custody sergeants. Police don't get a lot of training in mental health. They often get stuff around the law, but they don't get how to have conversations. Most of their call outs to people are around mental health. Also work with the health service. So nurses, again, doctors don't get a lot around mental health. It's very much physical health based. So security guards within hospitals, consultants, nursing staff, ambulance staff as well. Most of their call outs are linked to mental health. So we do a lot within those. Also within the education sector, been called in post-pandemic to support teachers who are struggling with behaviour in the classroom. So the WHO, we have a very long list in terms of the WHO. Do you want me to say a little bit about why as well? Yes. So why all of us have mental health. So at some point we are going to have concerns, struggles with our mental health, whether that is stress or anxiety, whether we're working too hard and we're reaching burnout, or whether we are experiencing mental ill health, which any of us can experience. And the key with mental and physical health is that they're joined, they're integrated. So when we get physically unwell, if we break our leg, or we have the flu, or we have a cancer diagnosis, that impacts our mental health, whether we like that or not. And also, when we're mentally unwell, we get physical symptoms. So we can't separate those two things. What we have at the moment is a really advanced physical health system and a very Cinderella mental health system. So all of us are going to have that need at some point to be supported around mental health. For me, I've studied psychology since A-level, so it's been quite a journey for me. I've gone through that professional career, specialised as a health psychologist, and worked within NHS for 14 years, worked for Cambridge University in research for about 4 or 5 years, and have been a freelance trainer for all of that time. For me as well, I've had my own personal experience of mental ill health, which gives you that insight that you don't get from a textbook. So experience of anxiety, depression, post-traumatic stress disorder, the list will go on. And my unique selling point at Promote Mental Health is that I can integrate that within the training along with the professional experience that I've had for 24 years. So that's a little bit about Promote Mental Health and me. Thank you.